Hello and welcome to this webinar. The focus today is going to be on the role of the mental health lead in schools during the COVID-19 pandemic. I'm going to be sharing my thoughts around some of the issues that have been raised just recently, I suppose, and also some of the resources that both myself and Dr. Ali DiMario think are really going to be relevant and pertinent for this role going forwards. I was originally a teacher and then trained in the year 2000 to become an educational child psychologist. During this time, I have written extensively supporting school-based staff, DELSAs, SENCOs, mental health leads in particular now, in terms of developing resources and using key tools and strategies from therapeutic approaches, overall focusing upon the well-being and mental health of children and young people. This has always been my passion and something that I continue to do well into my twilight years probably. Many of my resources are available from the charity Nurture UK. I've had a long and extensive relationship with them, which has been over many years, and very, very proud of the things that we've produced and the toolboxes in particular. I also write extensively with Sarah Miles at Hinton House Publishers, so I'm going to make reference unashamedly to some of these resources today, particularly because I think they have real relevance and pertinence to the experiences of young people and their needs currently during the transition process back to school this summer during this pandemic. And also I think that I'm very, very passionate about people in schools who are working so incredibly hard and under so much stress and pressure, having to reproduce or recreate things for themselves in terms of interventions for children, young people. There's so much that we've done, and there's so much that has a very good evidence base that I think we can make use of now in this time, and ensure that our children get the kind of individualised and group support and initiatives and interventions that they need. I'm absolutely delighted today to be presenting this webinar with Dr. Ali DiMario. She's an educational psychologist for the Xavier Catholic Education Trust in Surrey, and has worked extensively over the years in the areas of mental health. She has a real passion for nurture and is extremely well informed in areas such as attachment and supporting children with anxiety and stress management issues in the school context. She's established a network of mental health leads across her trust and is passionate about promoting all things nurture. I think I'm very proud also, obviously, to be working with Dr. Ali DiMario, because she was formerly a student of mine at the University of East London, whilst I was her tutor, academic and professional tutor on the Doctorate for Educational and Child Psychology. So this is fantastic that we were able to work together again and make what I think is a real difference, hopefully, to the role of the mental health leads now going forward, post and during this current pandemic. So the context that we're finding ourselves in is really complex. But I think that it has remained the same in the sense that schools do have a significant role to play in terms of providing support both at a whole school and individualised level to ensure that mental health leads of individual pupils and the whole school system is supported effectively and in the most nurturing, appropriate, evidence-based manner. The DFE guidance in 2018 made explicit the specific roles of staff teams in schools regarding the development and ongoing provision for mental health support for children. One of the key 4 areas here is that of prevention, and clearly what we want for all our children is a safe, calm environment where these problems are going to be less likely simply because children are feeling safe, secure, nurtured and looked after in the most appropriate way. But the idea is that we also need to ensure that any needs are identified at the earliest possible stage so that an accurate assessment is made and also the appropriate support is put in place as early as possible. We know from years and years of experience and research conducted extensively by a range of different groups and parties that actually getting that support in early is an absolute essential for children if we want to prevent the escalation of these difficulties and problems becoming far more severe in the future. The 4th aspect of this specific role, I think, for the mental health lead in particular is to ensure that specialist support is engaged with and ensured for these children. So the external agency links are there in place and used most appropriately to ensure that they have the kind of specialist support and provision or treatment that they need as soon as that is appropriate and necessary for them. I think we're all well aware now of the current issues for children, young people, and the fact that mental health needs have increased clearly within our younger population, both younger children and our teenagers. The issues are pretty clear, pretty apparent. You know, there's greater family breakdown. There's much more pressure for young people to have access to money, the perfect body and lifestyle. So the kind of media and materialist culture really does heavily influence our young people. Also the notion of this 24-hour social networking, again, the pressure that puts on people, particularly young people who are hypervigilant, checking their profiles online, how many likes they've got on Instagram, WhatsApp groups, etc., etc. I think as well, bullying has never really gone away and is probably just morphed slightly into something more insidious, really, because it is mainly online now. And I think also the online world is promoting this early sexualization of children, which adds pressures. There's more violence in many communities, and that's directly linked again to the social injustice of poverty. We are well aware of that, and also the fact that schools are becoming more and more like exam factories, with a huge number of children feeling very, very pressurised and stressed in terms of the amount of assessment that they are being asked to undertake. And of course, currently we know that 13% of our 16 to 24-year-olds are not in employment, education or training, so that does have a significant impact. In this current time, as we navigate our way through the COVID pandemic, it's never been as important for us all to be able to manage our own well-being and mental health. In my view, it's an essential if we're going to be able to successfully nurture and support our children and young people, many of whom may well be experiencing significant levels of stress and anxiety. I think the impact of COVID on children and young people's mental health and those of the general population cannot be underestimated. And particularly for our most vulnerable groups, there will be a need to ensure access to appropriate therapeutic input at the earliest opportunity. For all of us, essentially, children and adults alike, we're going to need to consider a range of factors and reflect upon these if we're going to be able to successfully navigate our way forward through what is going to be a significantly different, normal, everyday experience. Some of our children we know, and some families will have had a very relatively pleasant experience of lockdown and been able to do lots of lovely things together and to have built connections and relationships and enriched those and engaged in lots of wonderful, lovely creative activities. However, we have to also factor in here that many of our children who have experienced poverty, deprivation, whose parents are anxious, whose parents have lost work, who are worried about paying bills, etc., will have had a far less pleasant time, and this would have been very, very difficult, very stressful. And unfortunately, for a significant minority of children who will have experienced abuse and trauma during this time, the impact of that is going to be much longer term, and the level of nurture and support and therapeutic input they're going to need is going to be much more intensive. Some children will have experienced a significant bereavement or total neglect during this time. So again, that needs to be addressed on return to school. And for many of us, the social connections that we've had with each other will not have been maintained in the same way. And this is really particularly pertinent for children with mental health difficulties. Some of our kids don't have internet access, so they won't have had the ability to keep up with the work, to access the learning and the academic resources and input that they needed in order to do that. So getting used to this new normal for all of us is going to be very complex. It's a tricky process, the new rules and expectations that are going to be placed upon all of us will cause a great deal of stress for some. For others who are resilient, they will adapt relatively quickly. However, I think it's really important to just remember that this is a complex situation. We've never experienced it before, so we need to be very careful that we pay particular regard to all of these factors as we go forward within this pandemic time. So COVID-19 effects, I think, the Young Minds research, which was published in March 2020, did actually show us that the pandemic was having a significant and profound effect on young people who already had mental health issues and problems. So they surveyed 2,000 young people with existing conditions. So that would not be a surprise to many of us who work in this field, because clearly that sense of isolation, the lack of social contact with friends, who normally would be a really significant factor, particularly for teenagers in terms of providing support when mental health difficulties are clearly evident, is going to have a significant and problematic impact. I think what's interesting as well is that the link between those difficulties currently and also the increase in anxiety, sleep problems, panic attacks, and those urges to self-harm. Alternatively, I think we need to just stop and pause as well, because although this is clearly a fact, it's clearly something that's got to be an increasing concern for us, I do think we have to be careful, very careful, about considering the fact that for many of our children, they will have had a reasonably decent time at home. They will have had some greater access to playtime, to being with siblings, to being in a context that's safe and nurturing. So although in the coast-based study by the University of Oxford, 1/5 of children said they didn't now feel safe to leave their homes, conversely, what we have to think about is that 4/5 of children did not say that. So 4/5 of our children actually do feel okay about this. They're quite looking forward to going back to school. They will be resilient. They'll be able to adapt to a certain extent quite quickly, possibly, to new routines, to new do's as opposed to don'ts. So do keep your social distance, do sit in this desk, do play in this way, do create a game or something social to do with each other where you can actually do that at some kind of social distance. So I think we have to be very careful not to over-medicalise or talk about this kind of post-trauma that is going to be common to all of us. It will be very different. We will have different experiences of this. The important thing is that we listen to each other, we share those experiences, and we support effectively the most vulnerable groups in this particular time. However, I also don't want to, in any sense, underestimate the significant impact for some children, young people and their families. A conversation I overheard on my early morning walk, my early morning exercise, was really quite poignant. 2 little boys with their mum walking up the hill, and one boy who was about aged 8, I'd say, asked his mummy, why do you have to go to work, mummy? I don't want you to go. I'm worried that you're going to get the virus. And she was very calm, very gentle, but she said, I'm an essential worker, I've got to go in. But he said, you might die. And she said, well, we'll all die someday, but I'm being really careful, so you mustn't worry about me. But I think what was the kind of most poignant element here was, I feel sick when you go. This is anxiety. You might not come back. I think we should all just stay at home. So the beginnings here of school phobia, school refusal, anxiety around leaving the home, separation anxiety. We can't be safe anywhere else, was what this child said. So there's going to be a lot of work that has to be done with some of our children and young people in terms of ensuring that they do feel that they can be safe. And as adults, we need to ensure that we feel we can be safe so that we can model and impart that sense of safety to children and young people. I don't think that that's a small ask. I think that's an enormous task. But I think as human beings, we are, most of us, reasonably resilient. We're reasonably flexible and we're able to adapt. That's how we survive. And I think this is going to be a real time for adapting in the most nurturing, cohesive and supportive way. So for my little 8-year-old boy, whose conversation I overheard alongside many of our children and young people, and particularly, I think those who are from the more vulnerable groups who've had a less happy and much more traumatic and vulnerable time at home. We need to actually focus on this notion of prevention being better than cure. We need to get in there as early as possible, ensure that they access the right kind of support and nurture at the earliest opportunity to stop those numbers increasing at the top end of the continuum for those who actually need more specialist support. So I'm now going to move on to the role of the mental health lead and the impetus and the real kind of focus of this presentation today. We've developed this toolkit for Well-Being Toolkit for mental health leads during the last year and a half, and I think that now more than ever this is going to be the go-to resource for our mental health leads in schools, but particularly at this time of the COVID-19 pandemic going forwards. But I want to just reflect a little bit on the rationale for this initially and what we did in terms of sorting and evidence-based for the contents of this particular programme of support for school-based staff. We did a small-scale research study in 6 high schools during 2017 and 18. The data that we collected was analysed using a thematic analysis, and we are specifically asking children and young people what they did and did not need from mental health support in their schools. We wanted to know what their agenda was, what they wanted, and this is all about listening to the voice of the child and what that child or young person is actually saying, because I think this is sometimes gets missed in the mishmash of everything we're trying to do with the best of intentions. We very often don't stop and pause to ask the child what it is that would help and support them in the best possible way to improve and sustain mental, emotional well-being in the school and outside of the school context. So I'm going to go through the key themes that came from the data analysis from the focus groups and the interviews, and I don't think many of them will be a surprise. These are the issues that came up for the children and the young people. I would say initially, before we go through them, that these were not particularly surprising. They mirrored, but they didn't totally confirm our concerns as adults or professionals. There were some serendipitous things that came from this that I think were pretty useful to us and certainly informed the contents of the intervention. I'm raising this issue of informed consent right at the start because this did come out consistently as probably one of the biggest key themes, but it was one of the ones that I think needs to be really put out there in terms of we need to think about this as professionals, as teachers, as therapists, as those who are looking to work with and support young people improve their mental health and well-being. This notion of informed consent, it came across again and again that children felt you need to actually really listen to them. You need to listen to me and then act on my views, what it is that I want. One of the key quotes that I think has stuck with me from the research was this notion of people asking me to do things, to participate in interventions that actually weren't really suitable. I didn't like them, I didn't enjoy them, I didn't know much about them, I didn't really want to do this. So for example, this direct quote, I've got anxiety and I can't do mindfulness, although everyone else is asking us to do it, we have to do it every morning and afternoon. No one's noticed that I don't do it and it makes me even more stressed. Just a wee pointer here, I think it is important to raise this. For some of our children who have diagnosed anxiety disorder, mindfulness doesn't actually work. It can kind of re-trigger traumatic thoughts and incidents, and it can actually have the reverse effect. What it does as well is also can, in a whole class situation where everyone is doing mindfulness, can reinforce the fact that that child is quite different because they're looking around and realizing very, very quickly, I can't really do this, everyone else can, what is really wrong with me? So I'm not sure it can always be or is always that helpful. So for me, I think there is this need for us to listen authentically, and listening authentically is absolutely key to what we do as therapists, and that is without judgment, and that is without pushing our own views onto somebody else or thinking that we have the answers. Very often the children and young people can ultimately find some of those answers from themselves, from within themselves, from deep in their own psyche. So I think we need to be careful that we don't actually patronize children in many senses. For example, children were talking about being asked to give their views on the school council, invited to lunch by the head teacher to talk about mental health issues, planning PSHE lessons, etc. Now, these are really, really laudable things to do, and most of our schools, I would suggest, because they're excellent, in the main are doing this kind of thing and really engaging with children, trying to get them on board. So, you know, school council, etc., is very, very good in terms of really helpful initiatives. However, there are times on a deeper level when we need to think, does it really meet the requirement of informed consent? You know, have I actually said I really want to engage in this? Have I been told what it is to be in a nurture group, what that means, what the difference is going to be for me, etc.? On another level, for teachers, I think as well, I've had a lot of feedback around whole school well-being. This is particularly pertinent at this current time in the pandemic because people are very conscious about self-care, looking after their staff team. Head teachers are passionate about this in the main, making sure everyone's okay because they know if the staff aren't, then the kids aren't. But I think one of the teachers that I've spoke to recently did make the comment, you know, what would really help my mental health is not being asked to do yoga on Friday after school. It's not being asked to go and do this kind of cheese and wine thing with people when actually, you know what, I'm really tired. What would really help me is if I had to do less assessment, less record keeping, if the head teacher shut the school doors at 4:30 and made us all go home so that I had quality time with my kids and I didn't have to spend all weekend on paperwork. And I think we need to kind of listen a bit more to that and make sure that what we are doing as an intervention is authentic, that it really works, and we're listening both to the children and the staff. So the themes that came out were, not surprising, managing schoolwork and exams definitely was there as a key stressor for most children and young people, and particularly obviously around exam periods when the pressure is significantly ramped up. Body image also came up very frequently, and I think, again, this is no surprise. We're more than aware of the pressure on young people to conform to a certain image and the impact that this can and does have on their mental health and well-being. Social media and sexting also was a significant problem for many of our children and young people. They did seem to know about what was and wasn't legal, but there were some blurred edges around that. But they did feel that this was a significant pressure to be on social media all the time and to be sending images of themselves and posting things about themselves, portraying themselves as having a wonderful life and it was all glamorous and gorgeous and wonderful, etc., etc. And clearly for some of them that was just a total myth. So the pressure there, because of the dissonance between the reality and what they're putting out there, was quite significant for many of them. Relationships with peers and parents and carers, again, not surprising. The cause of many problems for many of our young people, not feeling understood, not feeling listened to, feeling ostracised, or because of some level of difference that they might perceive themselves to have, feeling not part of the peer group or the in-group. Sexuality and pornography came up as a key theme. And I think the access to pornography and the impact this is having on children and young people's relationships is nothing new to many of us who work with them and have to address many of these issues in the therapeutic context. So again, a huge pressure, and the impact that that has on their views of relationships and what is and is not safe and appropriate in terms of a sexual, emotional, loving relationship. Self-help tools came up, and that was quite encouraging, I think, in many respects, because they were able to talk about lots of things that they did in terms of managing their own well-being, and they had lots of ideas, and there was lots of sharing going on, particularly in the focus groups, which I thought was extremely positive. Self-harm concerns came up quite significantly, and again this is reinforced in the Young Minds study from March of this year, 2020. And I think this is ongoing, this notion of actually managing what is deep psychological pain through self-harm is something that these children and young people are increasingly concerned about. There's far more of it out there in social media forums, and I think just knowing how to support friends and talk to people and where to get help was a significant factor for many of them. Diversity and bullying, unsurprisingly, came up again and again as a theme. And again, this is not anything that I don't think would surprise anyone who's particularly working with teenagers and those who are having problems in terms of their gender and identifying gender and feeling comfortable with who they are. But also there were issues around race, there were issues around homophobia that came up too, and clearly these marginalised groups in many senses, I think, reporting far higher levels of overall well-being and mental health. So I think this is going to be something we need to continue to address clearly. And stress teachers came up. This is probably the most serendipitous bit, but I don't think this is going to be something unsurprising going forward within the context of the pandemic. What they were really saying here was that they felt the teachers were so stressed in terms of actually supporting them and ensuring that they got the grades that they needed, and they felt that stress was being transferred to them, that it was kind of being absorbed into their own psyche. And I think basically that the kind of mirroring that was going on was incredibly difficult and causing a great deal of problem for many of them. The notion of so-called alien services came up too, and there are a few quotes I'm going to make reference to after this slide just to highlight what we mean by that. But basically we are thinking about people coming in to talk to me, or I going out to talk to people who I don't know. There's something alien to me, people I don't know, so I'm not secure in terms of actually engaging in a therapeutic conversation with them. A lack of school-based mental health support was also a key theme. Children and young people were telling us that they wanted the help and support available in school now on a needs basis, and I think that is probably one of the key points to take away from this, and this is why I think we need to ensure that all our staff have access to appropriate levels of training and support, but also that there is an intensive programme and support system for them, which is facilitated by a mental health lead. So let's look at some of the quotes from the focus groups. We were asking them specifically, what do you not want? And here we go. I don't want to talk to a random person I don't know. You can see why that would be problematic for a child or young person. This is, I suppose, directly connected to the theme of alien services. Also, I didn't want to go to the CAMS person. She was weird and I hated going there. This is a direct quote. This is not my view. I just want to say that because there is that's quite a difficult one to get your head around, really, if you are a CAMS worker yourself and you're providing this level of intensive therapeutic support. But I think we need to listen to this. My mum got really stressed. She had to get time off to take me. We're not going to get kids to engage if they don't want to go, if they hate it, if they feel that level of antipathy, if they don't feel that they're talking to someone that they know and feel secure with and can trust. They're also going to get increasingly stressed if they feel it's having a negative impact on the family dynamic, particularly in this case on the mum and her ability to access work and earn her living. What do we also not want? We didn't want to have people stigmatise us because we had some of these issues. We want these things to be normalised, and we didn't want to have other people talking about me when it's supposed to be confidential. I think there is an issue here around the informed consent, but also the level of confidentiality and sharing things that the children felt were their own business, basically. And I love this from Harry, 13. He didn't want stupid lessons about feelings, which I can understand. And this really signifies to me how it's important that it is bespoke, that it's age appropriate, what we're doing in terms of emotional literacy, building resilience, teaching kids how to self-regulate. It has to be appropriate, and it has to be something that the children themselves feel comfortable with. I also think we need to be thinking about them developing their own toolbox. We don't want them to feel patronised, which is what Ben was saying he felt. They want to be given the offer. This is what's available. These are the key tools: mindfulness, CBT. You can use tools from positive psychology, whatever it is. But actually, these are the things that we're saying to you work for some people. Have a go, try them out, then pick the things that you really work for you and put those in your toolbox. Kerry is the significant little quote here, I think, is this notion that I don't want teachers stressing me out. They were revising and the teachers made it a nightmare because they were so over the top. I understand that, having been a teacher, I understand the need to get those results and ensure that your children do well and that the statistics are sound, if not brilliant. I get the pressure of that, but obviously this is very, very clear, isn't it? The kind of mirroring that's going on here. And a key impetus here for me personally in terms of developing resources for schools is this. I don't want outsider people coming in to talk about serious stuff for one lesson like social media or issues dangerous to children around grooming. I don't want them coming in to talk about self-harm, was another one that came up. I haven't quoted it here. They actually want to feel that their teachers have a handle on all of this. Not that they're experts, they don't need to be therapists, that's not what we're talking about, but the kids want to know that there is access to support in school, but also that the teachers themselves will engage with them and talk to them and learn themselves about these issues so that they can share their knowledge base too. Edward said he didn't want to be singled out for having support, and what he felt as well was that if there was some help for him at the start, that would have helped. And this is about transition and assessment on transition. This is going to be more important than ever now, that we pick up on the kids who are vulnerable, who are at risk, who are looked after, who do have sensory needs, who do have special educational needs in any form, but also who have mental health issues, vulnerabilities around anxiety, stress. These need to be screened for, and again, a key role for the mental health lead and the mental health lead with his or her team in a school context. So this role of the mental health leads in schools, originally the Green Paper putting this forward in 2017, proposing that every school should have a mental health lead, every school and every college. And in response to that Green Paper, the Educational Health Select Committee has published a joint report which was entitled Failing a Generation. That was the next year, 2018. And basically this was really, I suppose, quite critical of the government's proposals. In the sense that they felt the scope and focus of the planned interventions were not sufficient. They were planned over too long a time scale, and the actual mental health leader's role itself was really lacking in the kind of necessary detail, and also obviously protected funding. You know, there may be some money for this, which there has been in terms of actually trialling this whole new scheme. However, you know, how was that going to be taken forward? Now, sadly, I think because of Brexit in the first instance, but then also subsequent to that, this pandemic, this all seems to have been put on hold. We were due, I think, to hear in January who was going to be the main provider for this mental health in schools lead training, and how that was going to be delivered and how it was going to go across all of the schools in the whole of the UK. And of course, that kind of just doesn't seem to have happened. And I think there are lots of people out there saying, but you know, how are we going to take this role forward? We've got someone in our school who is a mental health lead, but actually, you know, what are they going to access? Is it a 2-day training? How is that adequate if that's all they're going to get is an introduction to mental health and your role, when actually what they need is a much more sound, secure basis on which to go forward. People need to feel that they have knowledge and expertise. They need to be able to pick up resources and know that they can actually deliver something that is appropriate, evidence-based, and feel secure that they're doing something in a safe way, okay, safe and ethical. So I think it's a really, really important initiative to be thinking about now as we go into this summer term, and then subsequently in September, many of us going back to school by then, and thinking about how we're going to manage the role of the mental health lead and the provision for children and young people and staff teams going forward. And I really hope that, you know, given the fact this current pandemic is ongoing, that this role is going to be more vital than ever, that we actually begin to see how we can engage with this particular resource that we've developed, this Well-Being Toolkit for mental health leads, and see how that can really begin to facilitate a secure base for staff teams in terms of moving forwards and developing the kind of provisions that they need within the school currently. So briefly, because I know my colleague Dr Ali Demario is going to go through some of the modules for this toolkit and give you some of the ideas around what they include and what kind of focus is and how that links to the current pandemic in particular, I'm just going to flag up the basic contents to this 20 module resource, which is really, really comprehensive. 20 PowerPoint presentations, 20 leaflets basically with which are quite significant, juicy handouts, I think, you know, quite comprehensive with lots of detail. We've researched it myself, Dr Amy Such and Dr Joe Wood, and produced something that I think is going to be really user-friendly for the mental health lead in schools going forwards in terms of providing training for staff, but also ongoing support and ensuring that people feel confident and skilled up to a level so that they can engage more therapeutically. I said at the outset that it's more important than ever that we can engage therapeutically with kids, that we can have the conversations we need, authentic, therapeutic and nurturing, that we can be regulated ourselves so that we can support dysregulated children, young people, and know how to do that really effectively and in a safe way. So I'm hoping that the contents of this resource will ensure that we can all do that. So I'll just quickly go through the modules. Obviously, the role of the mental health lead, clarifying what that is module 1. Understanding and assessing mental health leads, so taking you through some of the tools that you can use. You don't need to be a psychologist, obviously, to use these tools. That's why they're included in this resource. Understanding attachment disorders and creating an attachment-friendly classroom. That's more significant, I think, than ever, particularly this notion of an attachment-friendly classroom when children are coming back with some kind of attachment issues around leaving home and some anxiety around that. Understanding trauma and adverse childhood experiences, never been more important, because these children who have had ACEs, who have and continue to have adverse situations and things to cope with in the home, will be experiencing levels of trauma. We need to understand how to manage that and how to create and sustain trauma-sensitive classrooms and practice. The issue of self-harm, again, that came up in the research as something that children are concerned about, and ongoing, this is going to be an issue we know from the Young Minds research. Module 6 will be, sadly, particularly pertinent for some children who will have lost family members during this pandemic. So being able to know how to understand and support children and young people through this process of grief and loss will be particularly pertinent now. Understanding and supporting kids with ASD is module 7, and those with ADHD and ODD, module 8. And again, these are important because we have increasing numbers of children with these particular special educational needs in our classrooms, and sensory issues also. And that will be ongoing because there's a direct link between sensory issues and the need for sensory informed approaches with children who have experienced trauma. And then again, module 10, very significant now given the pandemic, understanding and supporting children and young people who are school phobic. This is very, very important given the fact that many of them will be very nervous about returning to school and will have developed separation anxieties. So continuing with this, I've alluded to this issue about stress, depression, anxiety disorders on the increase. We need to know as practitioners, as school-based staff, how to support children with such problems and issues in school. And also body image, understanding that and supporting children with specific eating disorders. The social media pornography issues, module 13, I've alluded to already. And also understanding child sexual exploitation, very important. Many of our children will have been at significant risk. A small minority will have had some level of exploitation, and this will have been more prevalent and pertinent during this period of lockdown when they didn't have the same kind of safety net of school and support staff around them. Then we move on to module 15, which is effective thinking using tools from cognitive behaviour therapy. And I include this because I think it's really, really important. This is something that all of us, you do not have to be therapists to make use of tools from this particular therapeutic approach. So that's why this is included here. And then finally, modules 16 to 20, the mindfulness-based stress reduction, very, very important, ongoing. I think there is real scope for introducing this and sustaining this within schools and for many of our young people, not all, as I said previously, but many of them. Managing exam stress in particular and developing study skills is very, very important too, and linked to that directly about actually managing the problems that we have when we're actually engaged with children, and we've got to ensure that they get the targets, they get the grades, etc. So I think that's very pertinent for staff and the students. Using tools for motivational interviewing, really good skills to have when we're actually engaging with kids, trying to motivate them and get them to actually see the motivation within themselves to engage in the change process. Positive psychology tools to build resilience has to be in this programme. I'm passionate about this, and I think that there are tools in positive psychology that all of us can use, adults and children alike, in order to manage our emotions more effectively, live what I would call genuinely more fulfilling and meaningful lives. So that has to be there too. And finally, using peer support circles for children, young people and staff. Very pertinent now as we are going back into schools, this time of transition, that we actually ensure that we give children and the staff an element of support, and doing that therapeutically in a group is hugely, hugely powerful. So finally, I think it's really important, just a quick summary here, that we flag up some of the key themes that have arisen from the research and why those themes have been included within this toolkit. This notion of informed consent again and again came up. So, don't give me what you think I need, but please get my permission, and please think about what I need, when I need it, where and how, in what context, and what my agenda is. So helping teachers to talk to us more, give us some space when we're stressing out. They're going to need this more than ever now in this aftermath and during this continued pandemic. But helping teachers to talk, they need the skills to do that, they need the resources, and hopefully this training package, the Well-Being Toolkit for Mental Health Leads, will enable the mental health leads to support staff in developing their skills, their knowledge base, and feeling more secure and confident about making use of key tools, not imposing them on the children and young people, knowing that one size doesn't fit all, but ensuring that those children and young people can access a range of different therapeutic tools and ideas and strategies. Giving us trained people in school we know and trust, again, that came up so often in the conversations with children, particularly in the focus groups. And this is something that the mental health lead with outside agency professionals will be able to ensure happens in a school. And obviously meaningful lessons, making it part of the whole school culture and ethos, a key role, a key element of the role of the mental health lead in schools. So I'm now going to hand over to Dr. Ali Demario, who will take you through some of the modules in slightly more depth, but thinking about how they directly relate to the skills that we need as we move forward within this pandemic to the next stage of children going back into school and ensuring that their mental health needs are met, and that the mental health lead can actually take this forward in a really confident way and feel competent and ensure that they're going to be doing something that really does make a difference for our children and young people and their staff teams.
Thank you, Tina. So I'm going to take you through a little bit more about the mental health lead role and also some of the sections from the Wellbeing Toolkit for mental health leads that I think are particularly important at the moment for the current situation. So how can we meet the objectives that Tina's just set out? Schools really need to know where they are to start off with. And a really good way to start off with doing that is by performing some kind of audit to make sure and have a look at what your strengths are as a school, what things you're doing really, really well, and what things you need to work on. A good way of doing that is through doing an audit. There are tools available online, and there's a really good one available in the toolkit to help you to do that. In order to do that really well, what I've recommended to our mental health leads is that they also incorporate surveys into doing their audit, because if a senior leadership team sit together with the mental health lead and try to fill in an audit about whether their staff feel valued, etc., it's quite hard to do that without actually asking your staff. So performing some kind of survey that goes out to staff to ask them about their well-being, how they feel that they're valued within school, and also to the children and also to parents is a really good way of making sure that you really know where you are as a school and to make sure that you can focus your interventions correctly. One of our mental health leads, she suggested a really good way of looking at whether staff feel that they're well looked after and whether the interventions that they were putting in place for staff were helpful. So what she did was she put a list of all the different things that they do as a school for staff well-being, and then she asked them to rate them in terms of which ones were most helpful to which ones were least helpful. And that had two benefits really. They could see straight away what was really useful, and also it was highlighting to staff the massive range of things that they were doing for their well-being that staff potentially didn't quite realise were there for that purpose. So schools need to know where they are. Schools need to know where the children are. So just as we would monitor academic achievement, a lot of schools don't currently monitor well-being. And that's obviously really important because there are some children who could quite easily fly under the radar if we don't monitor that in a similar way. So the toolkit takes you through ways of doing that as well, and I'm going to talk about that on the next slide. Everyone needs to know who the mental health lead is and what their job role is. And finally, mental health lead needs to have the resources to be able to provide support for all school staff to be able to support the children, just as those teenagers were saying in the focus groups that Tina Rae had done. the children, they want the school staff to be the ones that can support them because they're the ones that they know and trust. But the mental health lead needs the resources, and there are lots of things out there that can help mental health leads, but some of them are extremely expensive. And really, we've got to think about what is possible within the constraints of time, and within the constraints of money as well. So I think that's another reason that I've bought this resource for our mental health leads to use. So what is a mental health lead? According to the Department for Education in 2018, the mental health lead is responsible for coordinating a whole school approach to mental health. They're responsible for supporting the identification of mental health difficulties through monitoring, as I've talked about in the previous slide, access to local specialist support services and making those referrals, coordinating and overseeing outcomes of the interventions within school, and also supporting staff to support the children and raising awareness. So being able to deliver confidently a range of training to staff. And that again is where I think this toolkit is really brilliant, because it gives you the PowerPoints to be able to run with that with really detailed script. So it can tell it gives people the confidence to be able to deliver that kind of training on evidence-based approaches. One of the first chapters in the toolkit is about understanding and assessing mental health needs. So it takes you through step by step how you would go about monitoring the well-being and mental health of the children in your school. It's really important at the moment, I think, because the pandemic, we know, is not going to impact all of us in the same way. There are some people that you might expect to be finding it really difficult, who actually are perhaps less anxious at home, and may find the transition back to school actually reasonably okay to deal with because of the protective factors that they have. But there are other children who perhaps we've never recognised as having any kind of issues before, who suddenly will start to maybe feel anxious for the first time. So it's really important that we monitor and make sure that no children do fly under the radar. In order to do that, we need to use what's called a graduated approach. So it's the assess children, plan what you're going to do some kind of intervention, whether that's something universal that you do for all children, a small group, or maybe something individual, and then review, possibly using the same measure that you used at the beginning. One thing that I would say, and it also says this in the toolkit, is that we need to be pragmatic about how we go about monitoring, because it can be very, very time consuming and labour intensive. As someone who's tried to screen a whole secondary school year group, I can tell you it took a really, really long time. I used the strengths and difficulties questionnaire, which was great, and it actually gave us some really good data to work with, but it took a really, really long time. So there are other things you can do. You can obviously use those kind of standardized measures, which are great because there are lots of them available, some of which are free. But the really good thing about those is it allows you to compare the child against the population of other people of their age. So that can be really useful. However, if time is maybe a little bit shorter, as it is for most school staff, some things that you can do quite simply are things like scaling. Mary Meredith, the inclusion lead in Lincolnshire, suggested in one of her recent articles a really, really helpful way of doing this. So she said what can be really effective is maybe getting children to scale how they're coping on a scale of 1 to 10, maybe doing that every day at the beginning or maybe once a week, and then asking just a simple question as well, for them to write down one person that they feel that they could talk to if they needed to. And in doing that, you're getting a really quick snapshot of how they're coping, and you're also checking out the protective factor of whether they have somebody to turn to if they needed to, because the ones that we would be particularly concerned about obviously would be the ones who are really not coping well and don't feel that they have anybody to turn to. So scaling is a really good option to give you a quick snapshot. You can also rely on regular staff feedback, so making sure that you're having regular pastoral meetings about certain children to make sure that you think they're all doing okay. The issue with that, I suppose, is that some of those quieter ones that keep their cards quite close to their chest and wouldn't tell you how much they're struggling could easily not be noticed in that way. And that's where I think scaling and self-report questionnaires can be a bit better. You can also use surveys developed in school. So things like SurveyMonkey are really useful for taking out all of that time that you usually would be required on the analysis. And also, in whatever measure you use, make sure that you also look for protective factors as well as risk, because that will really help you to be able to weigh up and see whether that child is particularly at risk, or whether actually they might be quite resilient. So the chapter on understanding trauma and adverse childhood experiences is clearly going to be very useful in the return to school. Trauma is defined as a psychological, emotional response to an event or an experience that's deeply distressing or disturbing. Now, some children won't have found the pandemic deeply distressing and disturbing. They might have been at home actually been quite protected from it and having quite a lovely time. But for some, it won't have been that way. They may have experienced toxic stress, there may have been conflict within the home, they may have not felt safe in their home environment, they might be very anxious about going outside or about what's going to happen to them or their family, they might have experienced bereavement. There are so many reasons why some children will have found this very traumatic, and children are particularly vulnerable to trauma due to a lack of accurate understanding of cause and effect. They're less able to anticipate danger, so they're less able to feel in control and know how to keep themselves safe. And also, they're less able to express how they're feeling. So, whilst we might think that children are naturally very resilient and able to just kind of carry on as if nothing has happened, sometimes it's not that. It's not that they're not impacted, they're just not able to express how they're feeling. And we might see how they're feeling later on in their behaviour. There obviously isn't lots of past research into the impact of quarantine and isolation on children, because this is such a new situation for us. But there was actually some very useful research done back in 2013 by Sprang, looking at these kind of disease control measures in children when there was the SARS epidemic. And they found that a third of children who were kept isolated did experience trauma. So obviously it's something that we do need to keep in mind. We also know that children need to feel safe before they can learn. So it's important to have some key ideas in our toolkit of how we can support children to feel safe so that then they can go on to learn. I've picked out a few sections that I think are particularly useful from the toolkit in terms of the impact on mental health. Those areas are attachment, anxiety, stress and depression, self-harm and school phobia. So attachment, I think, is going to be really useful because for some children, their consistent, safe base is not necessarily somebody from the home environment. Sometimes for that child, the person who's been most sensitive and most predictable in their lives and most giving them the most warmth and nurturing care is a member of school staff. And obviously, by the nature of schools, we are very consistent and very predictable. But in this situation, suddenly, with very little notice, school closed down, and then some of those relationships will just not have been there for them. An absence of that safe base may lead to feelings of insecurity when they do come back. Anxiety, stress, and depression is quite an obvious one, really. Some children will have experienced prolonged toxic stress, as I explained before, as a result of the pandemic. Particularly, there are things that we know are linked through research to feelings of anxiety and stress and just poorer mental health outcomes. Things like loss of social relationships, loss of routine, loss of feelings of control, and loneliness can all really impact on our well-being. Self-harm, we know from the Young Minds research that self-harming has increased. Young people may not have the skills, the social support, or the opportunity to express their difficult feelings. Also at home, they may have fewer distractions, and we know that distraction is a really important way of being able to stop that self-harm cycle. They have more time to ruminate or have those thoughts and ruminate on those thoughts, and more opportunities to harm themselves with fewer people around them, maybe to intervene or to notice some changes in behaviour. And finally, school phobia or emotionally based school avoidance. So the time away from school may have actually reduced anxiety for some children, which will then have the impact of reinforcing that being at home. And we know from lots of research into school phobia and school avoidance that the longer children are away from home, the longer children are away from school, the more difficult it is for them to cope on their return and to be able to reintegrate back into school. So this cycle of emotional based school avoidance is in the toolkit, and I think it explains quite clearly how this could be an issue at the moment. So having anxious feelings about school can then lead to negative feelings and thoughts about school and their ability to cope with school. They then end up avoiding the situation that's invoking the anxiety, and that immediately the anxiety then reduces, and that's why it's really reinforcing for them to be at home, because if they do the cost reward analysis, the rewards of being at home are much greater than the benefits for them of being at school, and then that increases the school avoidance. And I think this quote is really nice from the toolkit, where it says school refusal occurs when stress exceeds support, when risks are greater than resilience, and when pull factors that promote school non-attendance overcome the push factors that encourage attendance. And clearly at the moment, those pull factors are really ramped up, because there are so many reasons that perhaps children will not want to attend school, and also parents might encourage that non-attendance as well, for very understandable reasons. One of the things that school staff often say to me when I'm talking to them about mental health and speaking to children about their mental health and well-being is that they feel worried that they're going to somehow make it worse for them by saying the wrong thing or doing the wrong thing. And one of the really nice things about the toolkit is it gives you some scripts and suggested questions to use to be able to talk about mental health in a really safe way. So some of the things that they say in the school phobia chapter about how to talk to children about their anxiety is, what name would you give the feeling that you experience when you talk about school? Because often we talk about anxiety, but for children, and particularly young children, that's not really a word that they have in their vocabulary, and they might call it something completely different. So it's important to use their wording when you talk about it, otherwise you might be talking about completely different things. Another question you could ask could be, if it was a thing, what would it look like? What would it say? You could get them to draw how their body feels when they think about going to school. So they might draw kind of a wiggly bit on their tummy, or shaky arms and shaky legs. So it's really getting them to explore those feelings the physiological feelings that they have in their bodies when they're feeling anxious, because recognizing that they're feeling anxious is a really key thing. And then finally, use an anxiety thermometer or a ladder or scale to ask the child about aspects of school that they find most difficult. So kind of making a hierarchy of fear, really. So it might be particular places. Is it the dinner hall that makes you feel really anxious? Is it the classroom? Is it the playground? Times of day? Is it particular people that are very worrying, or particular lessons, etc.? Unfortunately, one of the key issues that we're going to need to consider for mental health leads upon the return to school is coping with bereavement, loss, and grief. So most children don't need grief counselling, because what they're experiencing when they're grieving is a very normal response to a difficult thing, and what they really need is therapeutic interactions with people who they know and trust. Often staff don't feel well equipped enough to be able to talk to children about bereavements, and they feel that actually we need an outside agency who know what they're doing and know how to talk about this. But actually, what we need when we're grieving and when we're sad is to be around people who we know and trust and love. And that is those members of school staff who already have those existing relationships with children. So the toolkit gives you some really good tips about how to cope with those situations. So top tips really: tell the truth. Use something called the Goldilocks principle, which is not telling too much and not telling too little. So if you don't tell children enough, they end up filling in the blanks with their own imagination, and often that can be worse. So you need to tell them enough so that they fully understand, but not so much that it's going to be inappropriate and upsetting. So tell the truth in an age appropriate way, and avoid metaphors is really key, because often we're really scared to use the word death or died, and we end up using phrases like we've lost them, or they've gone to sleep, or they've gone to a better place, and all of those things can be really confusing for children. So just stick to the word death, really. Normalize their feelings. So even if they're feeling kind of okay, or they might be quite numb, or they might be absolutely distraught one minute and then feel okay the next and feel guilty for feeling okay, all of those feelings are totally normal, and just help them to feel that they're not going mad, and that all of those feelings are normal, and that at some point it will become easier for them to cope with. Provide reassurance, And just also have an understanding yourself of the fact that children's understanding of death is going to depend on the stage of their development. So for very young children, they may have kind of this magical thinking and not really understand the permanence of death and think that the person's going to come back to life. And then children, as they get a little bit older, maybe kind of around the age of 6, sometimes they might start to ask really morbid questions because they're quite curious and they don't have that full understanding. And so it can seem very insensitive to us, but actually it's important to answer those questions and allow them to ask the questions that they need to be able to develop a bit of an understanding. This is one of the activities from the bereavement and grief section, and it's the Talking Stones activity. So it's where you provide a child with a selection of different stones, some of which are nice and shiny and sparkly, and some of which might be a bit more dull and a bit more sharp, and ask them to select different stones to represent different memories. Some of which are going to be positive, lovely memories, and some of which are going to be the more difficult memories. Talk about the memories associated with each stone, and then make sure that you store the stones somewhere safe where the child can access them. A second key issue for mental health leads to consider is sexual exploitation and social media. Clearly, young people have been much more reliant on social media for maintaining their relationships during the pandemic. And social media, in some ways, has been an absolute godsend, and it's allowed those connections to carry on, and it's allowed those children to keep those relationships and to feel connected with their peers. However, research shows a consistent link between the heavy use of social media and poorer mental health. We also know that increased time online may increase opportunities for grooming and for sexual predators to contact children, and it may have put them at additional risk. And adolescents, in the absence of their physical relationships, may have engaged in riskier online behaviour, whether that's coerced or willingly sharing things like nude images and sexting, which can put them at risk. The toolkit provides mental health leads with good information to ensure that they feel confident to be able to deliver this training to the rest of their staff. So information that's included in there are things like the online tactics used by groomers and phrases that they might use. Let's go private, asking where the computer is in the house to make sure that the children are away from their parents or siblings. I know someone who can get you a modelling job, using flattery. If you don't, I'll, and using that kind of blackmail to get what they want. Using love, you are the love of my life, and saying things like, I know a way you can earn money fast. All of these are online tactics that are used by groomers and described in the toolkit. And the training resources make reference to this really useful site, which is the Child Exploitation and Online Protection Command. So it's one that I'd really recommend that you have a look at if this is something that you're concerned about. And finally, thinking about key interventions to use to support children and young people within schools, there are some brilliant ones that have a whole chapter in this toolkit. So mindfulness, I think, is excellent thing to use at the minute because it's getting people to focus on the current moment rather than thinking about the past or thinking about the what ifs of the future, which is really tempting at the minute to think about what ifs and to become quite anxious about it because there's so much uncertainty. So focusing on the now is a really important skill that you can equip children with through using mindfulness. Using tools from CBT or cognitive behavioural therapy can be really helpful, especially if some of their thoughts that you can identify are quite irrational, or you can see that they're quite negative and maybe not very balanced. Using those tools rather than saying to children not to worry or reassuring them, using tools from CBT to really get them to challenge their own thinking can be very powerful. Use positive psychology to support resilience, and I'll show you one of the lovely activities in a moment. Using peer support circles so that you can allow peers to talk about the things that have impacted them, and you can use them to support each other, which is another lovely step. Rather than, I know for a lot of schools, they maybe feel quite concerned about being able to support mental health. So any children who are showing any anxiety or any issues immediately get escalated either to CAMS or maybe to their emotional literacy support assistant, their ELSA, which is great if they have those, but at the same time they can become completely overwhelmed, and especially in this situation where everybody has been in this very difficult adverse situation, there's going to be a lot of people feeling very anxious, so we can't rely just on them. So peer support circles, as well as having universal strategies that all staff can use, Then having peer support circles is a really nice middle ground then to have between the universal strategies and the ELSA, to be able to use peer support circles in there. And then finally, motivational interviewing can be useful as well. There are lots of lovely mindfulness activities that are given to you in the toolkit. One of them here that I wanted to tell you about is a mindful breathing exercise, which is something called straw breathing. So you place a straw in the mouth, inhale through the nose, and then exhale through a straw. For young children, doing that in a cup of water and making the bubbles can be really, really nice as well. This is something called the hot cross bun model from cognitive behavioural therapy. And for using this, you don't have to be a therapist to use cognitive behavioural approaches. So this really describes the interplay between thoughts, emotions, behaviours and bodily sensations and how they all link together. So the situation for all children is going to be the same. They're returning to school. That then leads down to the thought. If their thought is, actually, I'm a low risk group because I'm a child and I'm really excited to see my friends again, probably their emotions are going to be quite happy and quite calm. It's not really going to impact on their behaviour in any negative way, and their bodily sensation, they'll probably be quite calm and settled. However, if, like some children, their thought is, if I go to school, I'm going to get ill and I'm going to die, clearly that's a very negative thought. That's going to lead to emotions such as fear and anxiety. It might lead to behaviours like refusing to come to school or refusing to enter the classroom. And then bodily sensations such as anxiety response, the sweating palms, the fast heartbeat, etc. Obviously, there are things that we can do at all of these levels. So helping with the bodily sensations, we can use breathing techniques. We can help children to not avoid difficult situations, so we can change behaviour, and we can also help them with their emotions through emotion coaching and things like that, helping them to express how they're feeling. But really, the best place for us to intervene is at the very top level, the thought, because the thought is what leads to all of these other things. So if we can change that thought and help them to challenge that thought, then that's going to reduce their anxiety. And a good way of doing that is by testing the evidence. So rather than saying to children, of course you're going to be okay and we'll do our very best to keep you safe, the best thing to say to them, okay, what's the evidence for that thought? What's the evidence against that thought? And what would you say to a friend if they had the same thought as you? So get them to test out their evidence and see if they can come out with something that's a little bit more balanced. And the last tool that I wanted to share with you is one that I really like, a tool from positive psychology called Pat on the Back. So Pat on the Back involves a pupil drawing around their hand and then sticking the outline of their hand on their back. And then they've got to walk around the room. And when they meet somebody, you write a positive feature on the peer's hand outline. They can then take the hand off their back at the end of it and see all the lovely things. It has to be positive, all of the lovely things that people have written on their hand. Not only is that going to really support children with their resilience, but also it's going to help bond that class back together and help those connections that have maybe been lost. It might be that in this case you can't have them on their backs. It might need to be that they pass them around the room. They put their names in the middle of the hand and then pass it around the room so that you can maintain the social distancing. But I think it's a really, really lovely tool to help children to start to build on their self-esteem, feel more resilient and build back those connections. So thank you so much for listening. I hope that it's given you a bit of food for thought to think about the kind of issues that you're going to need to be dealing with and the real positives of having somebody who's a mental health lead within your school. If there's any more information that you would like, or if you want to make any comments, you can contact Dr Tina Rae at tinaray@hotmail.co.uk or her Twitter handle at Dr Tina Rae, and you can contact me on Twitter on Ali Demario EP. So thanks again for listening.